Hello, everyone. Can y'all hear me? Yes, no. Apart from the JH peeps, how about the others? Because they have their videos on, so it's easy for me to tell. You can hear. Okie dokie. All right. So welcome to day two. So just a few things. All right. Can you drop in chat? How is everybody feeling? Not just about the talk. How are you just feeling about today? Nervous, edgy. Okay, anything else coming up? I'm having one of those days where it's just one of those days. Yes. Anybody else having a day?
Ma'am, I just filled in my application form, so a bit of excited and also nervous at the same time.
Fantastic. Well done. Congratulations, you. Well
Thank you,
done.
ma'am.
Okay. So, what we're going to do is before I introduce our speaker, let's everybody just stretch your hands out in front of you. Let your fingers stretch out like your fingers are trying to run away from your palms. This is one of my favorite things to do. And then clench and then stretch again and then clench. Now, when you're doing the stretch, you're going to keep a soft elbow. You're not going to hyperextend over here and cause pressure on your elbow joint, okay? So stretch and now clench, stretch, clench. Do it as fast as you can. There you go. And then just shake it off. You'll feel a little bit of tingling. Shake your shoulders, shake your head, drop your head to the left. Breathing in through your nose, out through your mouth. As you breathe in again, straighten your head. Drop your head to the right as you exhale. Breathing in through your nose, out through your mouth. Breathing in, you're up again. And now you're going to do something called the flop breath. So you're going to take a breath in through your nose and then just go. Okay, once more, you're going to breathe in. You're just going to go out through your mouth. We're going to do one last thing. You're just going to rub your hands together. Take a rub, 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 rub. Generate as much heat as you can. Don't forget to breathe. So notice if you're holding your breath while you're doing this activity. Breathing in through your nose, out through your mouth. Just gonna get your warm hands and then just place it on your forehead. The breath in. Place it on your eyes very gently. Breath in and then exhale out. Place it on your cheeks. Place it on your nose and your mouth. And just around your neck. Just like that. Then just allow your fingers to comb down your neck just beneath your collarbone. Okay. So how is everyone feeling after that? Now, we've got Afra here on call. Okay. Afra, can you switch on your video? Okay.
Yes.
So Afra is someone who had worked with me and been an intern at my practice donkeys years ago. Okay. And we did a lot of wonderful work together. And today is simply about her sharing her experience as a hot bun out of the oven. Okay. How it feels since graduating, how she feels, and her experiences of applying for registration. I know I went through a struggle because nobody really walked me through it, and I had to learn it on the go, and I made a lot of wobbles there. This is simply us sharing experiences, and I want to qualify that this talk we're having and the talk we had last week is not organized by the University of Colombo. It is not associated to the University of Colombo. This is just me as a graduate of the program that I thought to initiate this information sharing session about experiences. Okay. Because every year I get at least 3 or 4 people asking me about who was the clinical psychology program. Do you get through? Like, what do we need to do to get in? There's just so much information that people want, right? And I may not have all the right information, but I do have my experience, which is right for me, and I am free to share that with you. And I just wanted to share it with you just so that it motivates people, it empowers any one of you who is trying to get onto the program and looking to be a clinical psychologist. Afra here is also, now I did it way before her. She just did it. So there would be differences in regulations, which I mentioned in the last talk, which
Hmm.
for her batch. And the next batch that has gone in, you, and the batch just before you who's graduated, they probably had different regulations too. So they're going to be changing for the most part, but fundamentally, how the program and your experience is just so unique to you, right? So that's all we're trying to do here. We're not trying to tell you that follow these steps exactly as we say. You will definitely get into the program. This is what the prescription of University of Colombo is. It's none of that. Okay, it's just knowledge and energy sharing. Have I got that? Does everybody understand that? Give me a reactions button if you've understood what I said, or put a Y in chat if you understood what I said, or put an N in chat if you're not really sure, okay, of what I said. Because once we have a reactions button for at least 50% of the people, is when we are going to move on ahead with Afra doing her share. Really want to ensure that there is no misunderstanding. Like, oh my God, we've attended this session. So you go to an interview and you say, hey, guess what, panelists, entered the JH talk. So does that count for credit to enter the program? No, it doesn't. Absolutely not. Okay. All right. So, Afra, over to you. The
Yep.
floor is all yours. Okay.
Okay. Hi. Hi, Rushma, and everyone else. Okay, where do I start? Um, I'll start with my experience during the infill, which was honestly amazing. I really don't think I would have had this level of exposure through any other route in Sri Lanka. And I feel very grateful that I got to do it. But like Krishna said, everyone's experience is going to be different. So for the current batch or the future batches or even my batch, there's going to be a multiple contributing factors that would determine how your journey in the program would be like. It could be who you are as a person, the changes in the program, and even world at the time. So this is really just my own experience. So I started in 2021 during COVID. So most of my lectures were online and placements were quite delayed because of lockdowns. And when they did start, they were challenging, but they were great. We had to do a lot of things independently under supervision, of course. But that really, really built my confidence, my sense of autonomy, and also taught me how to take responsibility of my own learning. It was self learned in some way. Um, Besides that, I would say balancing research and exams, they were a core part of the program. Or before I get to any of it, I'll go about the whole placement exam and interview. That's something that I get a lot of calls about from potential future students. I would say I think the structure of that also changes. It again depends on who is in the course at the time. So I am not to say whether it's too easy to get in or whether it's too hard. I would say as long as you know what you have done and the amount of experience or how you manage to crack the interview, it could be based on the exposure that you have had so far. Certain things does benefit you, like for example, the languages that you speak and all of them, but they don't determine. But again, they can be contributing factors that could be an advantage. Coming back, um, the course has, like I said, lectures, placements, research. So, a challenging part of the program for me was because of the crisis. Because I started during 2021, 2022. So the country was going through crisis after crisis after crisis. So it was not an easy time to be studying, going for placements, and balancing research. So time management was something that I personally struggled with. But over time, I think it became a key skill. I had to learn it through the hard way, but it was worth it because for me, research, there was quite a bit of challenge because of my set of participants. They were being school students, the schools were shut, so I couldn't really work on my data collection. So a lot of external factors played a role throughout my journey. But throughout the placements, I learned so much about um, professionalism, ethical practice, clinical skills, and how to interact with clients from a very diverse set of backgrounds because I was placed in three hospitals. So something I've realized over time is for each batch, sometimes it's the same, sometimes it changes, the hospitals that you're placed in. So throughout, I had to constantly reflect on my own strengths and weaknesses. That is what I was good at, where I needed to grow. So, and learning to work in multidisciplinary teams, it's very important because I think the whole clinical psychology field involved a private practice field of work and also community. So when you get into the whole private practice side of things, you might not be working with a lot of teams, but I realized how important it is to work with multidisciplinary teams. And that's an exposure that I got through the placements about how to communicate with families, caregivers, other professionals, because how to work together, how to document well, and how to manage complex cases at the same time manage my own emotional responses because it can be a lot. And something I realized along the way is that how easy it is to want to label yourself very quickly as a psychologist or a clinical psychologist, but this experience taught me that the title carries a lot of responsibility and a lot of work really goes into truly earning it, not just academically, but in terms of skill, experience, and ethical practice, very importantly. So I learned how to not to rush the process. It's something you grow into through you keep learning because psychology is a field that keeps developing. There are theories, yes, like benchmark theories, but there is development, there's upgrades. So that's something I really, really value and I appreciate in this journey. Yeah. Do I have? Am I okay, Rishma? I'm done, I think. Is there any questions?
Yeah, if you can focus a little bit about your experience with your application for your registration number, do understand that um, Afra doesn't have her Sri Lanka Medical Counseling registration number. Okay, it's a natural
Yep.
part of the process. She's just gonna simply share her experience of getting through the process and what
Yep.
she had to do, some of the things that, hurdles that she came across. She's going to just share a little bit more about that. Okay, and
Yes.
then later
So,
towards the end, after I'd like to bring you to, bring a lot of focus onto that aspect because I feel just in my experience, a lot of
mhm,
us can speak one on one to somebody who's qualified as a clinical psychologist who's been practicing and talk about the program and how it's done. And the admin side of it,
yeah.
which is very,
Yeah.
very important
Yeah.
to be a licensed practitioner, um, we don't tend to touch on that too much. So
Yeah.
if you can talk about it because it's fresh in your mind, and I know that you recently
Yeah.
did it. But listen, she's speaking from her current experience and what the regulations are right now. So those of you who apply and graduate 2 years later or 2.5 years later and apply 3 years later, you're not going
Yeah.
to message Afra and say, "Hello, Auntie G, you told me this in 2025. What the hell happened?" Okay, they're not asking for this document. They're asking my grandmother's, birth cert. I don't have it. Okay, so don't do that. She's just sharing her experience. Go for it.
Yeah. So regarding the license procedure, I think when I applied, there was a small change in the laws. So I would say every placement that you go to, there's a set of documents that you're supposed to keep. Again, I'm not sure if there's been a change from my batch to the next batch, but with my batch and the application process, I was supposed to keep my logbooks very carefully, signed by the supervisor. So logbooks as in every case that every client that you work with. Just give me 1 minute. Hold on. I'm sorry for the interruption. I'm sorry for the interruption. So yeah, we have to keep our logbooks, that is the case by case record documented the work that you have done. Okay. About the demographics or what kind of work you did with that client throughout. And then you have to keep your supervision records. That is, you will be assigned a clinical supervisor for every placement with whom you'll be having supervision. So you need to keep a record of those supervision sessions. And besides that, I'm sorry, give me a minute. I am trying to think. Besides that, you need to, oh yes, there is a though, and then we have a weekly logbook that we were supposed to maintain, but whether you, it can be an added advantage for the application process, but whether you include it or not is your choice because they strictly ask for the logbooks. And then even for the application, make sure you have your undergraduate documents and everything sorted because they will ask for that, the handbooks and stuff like that. Yeah, so from the MPhil program, you will need to keep your logbooks with you and the supervision record. Those are the most essential pieces of documents that are required. And when I say logbooks, they are not small. They can be a lot because you'll be doing, I did three placements, three clinical placements and one community placement. That's what we did in my batch. So we had to keep the logbooks of all of them and the supervision record.
Hmm. And you want to also talk about the whatever that 18-page application document is, just to, like,
Yeah.
um plant
So
some
though it's 18 pages, it had my undergrad details, my postgrad information, um, any certifications, anything like that, and proof of undergrad information. Like for each of the modules that you have done, you might have to provide proof that you have done it, either through a handbook or your transcripts and stuff like that. And then comes the clinical placement side of it, where you include all the placement documents, including supervision records. And yeah, even with the research, I was not sure if it's required, but I did include the signed off page and the supervision record with the research, the supervisor.
okay.
So overall,
So
that was what it complied. Even though it's 18 pages, it's a lot of documents, but though that's the gist of it.
okay, so do these pages did you require any sort of letter or extra documentation from a supervisor, or whatever you completed with is what you actually used to
Yes,
submit?
yes. So
Nothing was finished.
my application process required me to get, as it's mentioned in the application itself, get letters from the supervisors with their credentials and their experience because it was required, like their certifications and a letter from them that they supervised us with their education background and qualification.
So you had an extra layer. So see, my batch didn't have that extra layer. What you had was you needed the credential. Oh, I don't remember. Maybe that would be a better way of saying. Okay.
Yeah.
Um, Give me a moment. So what I understand is you had your documents that you were looking through yourself,
Hmm.
you were following through all the coursework, you had that goes for the
Yeah.
submission. Additionally, you have these supervisors who sign off on your documents. You needed to have a letter from them saying that you were one of their supervisees along with their qualifications, right? That um,
Yes.
that's what your process needed. Okay.
Yes.
um how long did this you collating all of this take you, Afra?
I kept it until last minute, so I I set a deadline for myself and I got it done within a week. But I've been in the, I luckily, my supervisors were very helpful. They gave me the documents very soon as I asked for it. That was very helpful.
Mm,
So I took about a week because I am an organized person. So I already had everything very put into proper folders and everything. So because that's my anxiety. So I am just very sorry. I think it was you, Rushma, because you told me that I had to have three documents set different sets for each placement to give. And I remember that I always made sure that I made kept it that way. So it was all there. I just
huh,
had to combine them into one book, which turned out to be a huge book. That took a
mm,
process because, yeah,
right. Yeah, I'm glad that that helped. But it's because I remember, like I told you guys, I was being, the new broom syndrome and like documenting very diligently every placement for first 2, 3 weeks, and then I got into a
yeah,
situation where I had to look through tons and tons of notes, which I have carried from each boarding place to my hometown, and then sit down, pull through all of it, and right, that was a real menace for my head, and I created the problem. So, okay, so there you go. See, guys, it's not as intimidating as it can be. Um, if keep on top of it, right? Just do a little bit every week. At the end, it looks like it's 5 days a week
I
of
mean,
work.
by the end of every placement, if you make sure that all your documents are signed off and kept, that's it. You're good to go.
Hmm.
Because you need
Yeah.
to make sure that you get all the signatures from all the supervisors and wrap it up. That's something I learned, not delaying that process and wrapping it up. But uni was also very, very helpful because they had a deadline for us to submit every document after every placement when my batch was doing it. So that was quite helpful because I had a deadline to submit all of the supervision records and the logbooks. Like I didn't have to submit all at once towards the end. I had to submit them within a week after every placement ended. So that
Mm,
was quite helpful for me and for the rest
right.
of the batch.
Yeah, because what I remember was I remember that you give it to them, and what made it easy was once it was given after
Yeah,
each placement, you go and ask for it at the end of it, and you have this chunk of stuff that they have for you ready, and you had already created it. They just kept it safe for you.
yeah,
I remember that part. Now we've got a couple of questions, Afra.
yeah,
Okay, I'm going to read them out to you. All right.
yeah,
Um, Oh, before I read out your questions, I wanted to tell the others that I did check up on the quota. I did check up on the duration. I did not receive any response. I actually checked on the night itself, and the response I received is that it could be different. They don't know. Maybe that is sensitive information that they don't release. Okay, because it can change. So the questions that you all asked last week about the quota and the duration is something where information isn't essentially released. I'm assuming because they said it's they don't know. Okay, could you please? This is your first question. Could you please tell us a bit more about the selection exam too? Okay, I'm gonna
okay.
read you the second one. How long will it be for lectures? How long for placement and for thesis? Could you please
Okay.
talk a little bit more on the placement test? So maybe you want to take the first and third question together and answer the second one later.
Yeah,
Talk about the selection.
so the placement test, I don't know how it was for the previous batch. I mean the current batch. But when I was doing preparing, I was breaking my head over it. I remember I took the little mini DSM-5 Rushma had. I brought it home and studied all the disorders in DSM-5 for
Ah,
the placement test.
yeah,
I
yeah.
remember.
That
I
was the
remember
DSM
doing
4
that.
TR that you took.
Yeah,
No,
the
DSM
small
5.
one, yes.
Oh, DSM
Yeah,
4
the
TR.
small. No, it was the purple
Yeah,
one,
the
the mini
spiral
one,
bound
the
one.
pocket.
Yeah, yeah. That was the 4 TR. And by which
Yes,
time it had come out already.
yes. So I bought it home. I studied the entire set of disorders in DSM-4. but I wasn't asked about any of that. Uh, I don't remember the questions I was asked, but do you think it's appropriate for me to talk about it?
Yeah, it's your
Because it can be
experience. I think
different. Because it can be different. So I have a vague memory of being asked about some questions on empathy and the skills, I
counseling skills.
guess. Yeah,
Mhm.
counseling skills. It was like a case-based one. That's what I remember. Uh,
Mhm.
it had two questions. I was stressed about it. I won't tell you not to be stressed about it, but I will also tell you not to be stressed about it because it helps. You prepare, so and but I know that the questions can be different from batch to batch because there will be different people in the course and different coordinators, different teams, so it can be different. So that was there.
Mm.
And the interview, of course, is they would give, I don't know the procedure right now, but there'll be a structure and you just have to go and answer that based on the questions that are in the structure. But I don't know if there's a change in the format of the interview.
Right. Okay.
Yeah.
So, one of the things is, yeah. So, how long will it be before? How, lo- how long will it be for lectures? How long for placement and for thesis?
6 months for lectures. I would say 5 to 6 months for lectures. And then ideally, what we were told was the placement was supposed to start by the end of the fifth month or the sixth month when the lectures start. But we had a delay because of COVID. I was supposed to start in May, but started in October because of the lockdowns, and we had to get vaccinated and all of that. But ideally, it's six
Mm,
months is what I was told, and 18 months of clinical placement and 2 months, I think. Yeah, I think
6 weeks of
2 months of
placement.
6 weeks of community placement
Hmm. Okay.
is what we had.
And all right. So this is what Afra had. Okay. So there are questions about. Could you please let us know if the students are allowed to do any kind of part-time work or income generating activities during the program? Since you've been through it yourself, I thought you'd be the best person to ask. I'd really appreciate any advice or insight you can share.
Okay. So I personally feel it depends on the type of work that you will be doing because and the requirements that you have in the placements because sometimes it can be very different and the amount of workload can be very um, challenging sometimes. And it also depends on the supervision sessions and everything you might have to consider. But I did do part-time work. I was tutoring, so it didn't really become a problem with me with the program. But for someone who had to go to office and do office work, I would say it's quite challenging.
Mm, 100%. Yeah, that's true. I mean, if you're trying to do, I don't think that there is a rule about you can't do any income generating activities. It's about choosing the one that would work best with the demands this program places on
Yes.
you,
Because it's a
because at,
full-time program. It's a full-time
yeah,
program. And there are some placements where you might be working until like 7 p.m., 6 p.m. It's up to you. But you might
yeah,
have to. If you have to meet the workload that's given, you might have to do that. So it's
yeah.
depends on
And like you
that,
said
the requirements.
about supervision, sometimes, some supervisors would want to meet with you physically. Some supervisors might be open to doing online supervision. I don't know. Depends on what the rules and regulations are right now for the batch that's going in when it comes to supervision. So you might have a commute from your placement maybe to your supervisor. So you got to document all of those things incorporate all that. What's the
Yeah.
gap between the application deadline and the exam date? So John,
Application
you're
deadline
referring
and
to
the exam.
the placement exam, is it? Give me a thumb. Is it you can unmute and speak if you want. Yeah, yeah. So application and the placement uh exam.
Application and the placement exam. I don't
Mm,
quite remember because again, my whole procedure was during COVID, so I don't know if they have a specific deadline and it takes time. But I think it was if I'm not wrong, I applied in August or September, and I had my placement exam and interview in October.
yeah, I think even mine was in October. I think I did apply somewhere in June or July. I can't remember um how long before you get the letter that tells you. That one cannot help you
I
there.
don't remember.
Um, um,
I'm sorry about that.
okay, so we have another one. Could you please let us know whether it is a must to have clinical experience? After your off video, just so you know.
Oh, sorry. So I wouldn't say it's a must, but it's beneficial. But please make sure you understand what do you understand when you say clinical experience, because the panel there knows what's the type of clinical experience that you should be having with the education background that you possess at the time. So there is no too much to it and also too less to it. Because in my batch, there were people with less clinical exposure, there were people with more clinical experience. So I'm not sure under what criteria they really look at. I
Mm,
think there's multiple ways of them looking at it. I would say it's an advantage. But when I say
mm,
clinical experience, it's not you having one-on-one experience with the client without supervision.
yeah. Just to add on to that, if you go onto the internet, I mean, don't do that now. If you're applying, just forget about it. Just apply. Okay. Get on with the process. There are other programs when you type clinical psychology and they say clinical experience required, right? But over here, like Afra said, remember that right now, also it's a very young profession in Sri Lanka. Okay. And so don't put so much pressure on yourself to think that, oh, I don't have it, I can't do it in whatever definition you carry. So I'm not gonna apply. Just apply. See what happens. Okay, so this is another
And
one.
one more thing to add, Rushma, that please be mindful again of the definition of clinical experience. Because when I went for my interview, my only experience was with Rushma, and that was inclusive of some level of clinical experience, but no community based experience. They all count. End of the day, it's about if you have worked in the field in some capacity in an ethical way,
Hmm.
I would say.
Now, so you have to understand that part of clinical experience is also looking at your ability time manage, how to do evaluations, and it doesn't necessarily have to be a diagnostic type of thing. How you view a situation, your critical thinking skill also goes into that. So if there are things, those foundational experiences that you've had that are showcasing these skills, do put them down.
Yeah.
Because it can help. So we don't really have to be in Colombo the whole time, yeah. Just for the lectures, if we be there, and we can do the community work and the placements in Candy. Is that possible?
No,
No.
no. The hospitals that you'll be doing placements will be given to you by the institution. It will be on rotation basis, so you don't get to pick and choose, unfortunately.
Yeah.
That's my
I was
experience, and my next batch also had the same. I think it will be the same.
yeah.
So
Um
community work is very less in this program. You only get 6 weeks of community work. The rest of the placements is clinical work, so you'll be in hospital.
hmm, okay. So I understand that lectures are happening at the beginning when you enter the course. Once you've gone through that, you've gone through some skill development and all that, you get the opportunity at the end of it to implement them and learn from them in your hospitals that you're allocated. Okay. So the course is considered 9 to 5. Is it like this
Mm.
every day or in some days short, just to understand if it's possible to have part-time job?
Um, I will again share my experience because I had online lectures. It was 9 to 5 for the first 4 months, actually. We had lectures 9 to 5 every day. There were
Yeah.
some days because of technical difficulties, if there were any issues, we had lectures on weekend, like 1 or 2 lectures, but that's it. That was only if
Mm.
we had technical difficulties. Otherwise, it was quite smooth.
So she's talking about your duration of the program in which you have lectures, but after your lectures and you get into your placement, that is a Monday to Saturday, Saturday half day. Is that correct, Afra? Is what you had?
Again, it depends on the placement, Ushma. Like in some hospitals, I was supposed to work only like 4 days. In some hospitals, I was okay. If you take one of my placements, I was supposed to work my mandatory days were 3 days, but I could come on extra days to see my clients.
Hmm.
So
All right.
yeah, they would have clinic days, they would have specific multidisciplinary teams. So 4 days a week was given, but in some hospitals I was required to be there for 6 days. Yeah.
Yeah. So remember that the call for applications, it already says on the application that Monday to Saturday for your clinicals. It
Yeah.
specifically states Monday to Saturday. This is Afra's
Because most
experience.
hospitals
Okay.
have um,
Huh.
because most
Chalo.
hospitals have clinics on Saturdays. The psychiatric clinics happen on Saturdays. So it's better to keep
Hmm.
your Saturdays available.
Yeah. So could you talk a little bit about the supervisors and the process of supervision?
Um,
And I think
the
that will
supervisors
be the
will
last
be,
question.
yeah.
Huh. Go ahead.
Uh, when they say, I'm not sure, are they asking for who the supervisors will be? Again, we don't have a choice. Will be assigned supervisors by the institute, who will be clinical psychologists mostly,
Hmm.
and uh, yeah, clinical psychologists mostly, or people who are accredited with some registration accreditation bodies, and they hold the certification to be practicing. The supervision process happens once a week. Um, for me, yeah, it was once a week. You either have it individually, or sometimes we'll be coupled up with another colleague and we'll be having supervision together. It could go either way. But then your individual cases can be discussed individually as well. And when I was doing my placements, we had feedbacks like midterm and in-term placement reviews. So those were essential for us to pass the placements to complete the program. So they
Hmm.
will, yeah,
So for supervisors, one thing you will have is this: every supervisor has a style, and some supervisors are very heart centered. Some supervisors can be very technical. Some supervisors will go by disorders. Some supervisors will bring their focus through the therapies that you're using. Um, so that the supervision process tends to revolve around that, and every supervisor,
yeah,
develops their own style and may have a preference. And so, which is why you rotate your supervisors, because you can learn
yeah.
a lot with everyone's style that they've developed. Okay.
I will share a bit of
Um,
learning with my supervisors. So I won't be stating names, but with my first supervisor, I learned to self-reflect a lot because all his session was about, it was about me. I felt like I was in a therapy session, but that was so helpful for myself because it was a lot of self-reflection, understanding my emotional responses, and that felt so helpful in my very first placement because I learned about the concept of transference and all of that, and understanding it at that phase of my journey was very important because I had two other placements coming up, and that was quite helpful. And in my second placement, I was again placed in a hospital where disorders were more profound and severe. So there was a very disorder focused thing, but my supervisor was very helpful in teaching me new techniques and helping me learn new things and she exposed me to new therapy techniques. She let me try them and she gave me feedback on them. And the third one was amazing as well, very amazing, to be honest, because it was more of me being grown up to certain level with my experience plus her expertise. So there was a lot of suggestions and a lot of constructive feedback that helped me a lot. Like
Mm.
on what could I have done better and what was a bit off about that session if they were, listening to the recordings or whatever. And then about um, asking me to read certain books and about certain therapy techniques so that expanded my knowledge.
Mm.
Yeah.
So thank you, Afra. We do have another question on chat, but this was addressed last info session, so you don't necessarily have to address it. It's about but I'm just going to read it out if you have anything you want to add on. I did my BSc in psychology, so this is the last question that we're going to take, guys, and then you can drop any other extra questions on the JH Talks chat, okay? I did my BSc in psychology from a private uni, and it's affiliated with Cardiff Met, UK Metropolitan. Could you please let me know if there any documentation that I must provide to confirm it is UGC approved? And should I get a letter from my university that I completed my degree there? I have certified my certificates as true copies. Is there any other certification we must provide? Any comments, Afra?
I think if the certificates are signed, that should be okay, but they might need a letter from UGC that Cardiff is recognized.
Yeah. So there you go. And we do have a link of the UGC website that was given to us by Adrian, who was on call last week, for you to go check that in. Then there was somebody else on the call who also had the same situation as you, and they just got a letter from the university to also say you've completed and this is UGC endorsed. Okay. One other thing to remember is we've come to the end, and to remember that at the end of the program, you will have a lot that you've learned, but you will also start to observe in compassion and with love that you don't know much. Okay, and that's a great place to be as well. You're not expected to know it all as you graduate, as with this certificate that says MPhil in clinical psychology. It's going to be a lifelong journey. So it's
Yeah.
not I attended this, I'm done for the rest of my life. Whew, good, now I know everything. The more and more you practice, there are billions of people, and it's just us meeting a couple of hundred people at different placements. So a bunch of them will have some similarity, some will not have. But as you practice through the years, you will start to grow into it and recognize, oh, I need to learn this slowly and steadily. I already know this. It just came out and presented itself. Okay. And that's it, everybody.
Yeah. Thank you for
Um,
having me, Ruswan.
you're most welcome. Thank you, Afra. Thank you, everybody else, for all your questions and listening in. Please, closing note is a thank you, and to let you know this is just two people who graduated from the program, just trying to share a little bit so you can feel a little bit safer and maybe a little bit more empowered. Okay?
Yeah.
So have a good one, everybody. Good night and take care.
Good luck, everyone.
All the
Bye.
best. Thank you, Afra.